Sierra Robertson. I am a veterinary technology student at HCC, and I'm going to be talking about Rickettsia Parkeri. It is a zoonotic disease found mostly off the Gulf Coast, the eastern states, hotter weather. It's caused by the Gulf Coast tick, Abelioma maculatum, and then let's talk about the life cycle. The life cycle of a Gulf Coast tick, the eggs will hatch within 21 to 50 days, and then they'll find a small rodent host, usually to engorge for 3 to 9 days. They'll leave that host, molt for 3 to 14 days, and then they'll become a nymph and find another larger rodent host, engorge for another 3 to 8 days, then leave that host, and then from 3 weeks to several months they'll molt again, and then they'll find their final host, which would be bigger subjects such as coyote, dog, cattle, human, etc. And then the cycle starts all over again. The contraction is a bacteria transmitted by ticks that can cause disease in humans. This bacteria belongs to a group referred to as the spotted fever group Rickettsia. It's the Gulf Coast tick, and this particular bacteria agent is the Gulf Coast tick. Rickettsia are transmitted to humans by the bite of infected arthropod vectors. They multiply at the site of entry and enter the bloodstream. They localize in the vascular endothelial cells and multiply to cause thrombosis, lead to rupture and necrosis. Treatment for Rickettsia infections, they respond well with the doxycycline. It's the antibiotic of choice for children and adults, and also in animals. All patients should be treated for at least 3 days after the fever subsides and until evidence of clinical improvement. Standard treatment lasts 7 to 14 days. Doxycycline is most effective treatment. It should be initiated early in patients of all ages with suspected rickettsial disease before diagnosis is confirmed. Rapid treatment can prevent death and disability, so that's pretty cool. And then to remove a tick, which I thought was pretty interesting, it should be removed immediately with a fine tip pair of tweezers, and you should be careful not to squeeze or crush the tick, because if you crush it, the fluids that are released from the actual tick may contain infectious organisms, so you want to be careful not to do that. And you pull upward with a steady, even pressure, and do not twist or jerk the tick. So you clean the area and your hands with rubbing alcohol and iodine scrub or soap and water. And if you want, you can keep the tick in a sealed freezer bag, and in case illness occurs, so you want to write the bite date on it, keep in case illness occurs within 2 to 3 weeks, and place in the freezer, just in case. Precaution. The longer an infected tick is attached, the greater chance that it will transmit the pathogen, so you want to be sure to check your animal if you go outside as soon as possible. For ticks, just do a quick run through. Check paws, because they can get, like in the picture, the ticks will wedge up in between the paw pads. You want to be sure to check into small spaces mostly. If you remove the tick and the mouth parts, you don't get close enough to the skin, the mouth parts will stay in the skin. So you would have to remove them with tweezers as well. You don't want to leave the mouth parts because they could also still contain the pathogen. So that's for tick removal. And then for prevention, for dogs and cats, you want to probably use a once-a-month topical, which is probably the best solution to keep ticks off. But if not, then you can also use shampoos, sprays, dips, and collars, and also powders. For humans, they have a variety of repellents that you can spray on before going outside, which is the off sprays or that contain DEET. You want to apply to the skin, and it offers several hours of protection. Repellents containing permethrin can be applied to clothing and lasts through several washings. If you use something containing permethrin, you want to be sure not to use it on a cat. It can be very deadly to cats. So just keep that in mind. If you're in a heavily brushed trail, you want to walk in the center, just to be sure not to brush up against any of the shrubs or trees or anything that can have a tick on it and jump onto you. Once you come in from the outdoors, you want to be sure to check yourself thoroughly to make sure and check the shoes inside your shoes and socks, because ticks are known to crawl into smaller spaces. Alright. So that concludes my PowerPoint for Rickettsia Parkeri. I hope you enjoyed it, I guess, and gained some kind of knowledge from it. Thank you. And then for prevention, for dogs and